healthy blood vessels, because that is one way that we're clearing the amyloid that we're making out of the body. Have to have healthy capillaries. So the circulatory system, the pump is our heart. And then we have arteries that carry blood throughout the body, to the kidneys, the lungs, to our toes, to our brain. And then the arteries get smaller and smaller, and then they form a very fine capillary network where oxygen goes from the blood vessel to the brain, and where glucose goes from the blood vessel to the brain, and where things like amyloid beta come from the brain back to the blood. And then the vein, at the other end of the capillary, carries the blood and the toxins back to the heart, and the heart pumps it out to the kidneys and to the liver, and things get cleared. Now this capillary network would, in our one brain, would fill this room. It is a huge, it's 12 meters square, 12 meters, it's because it's so fine, like a hairnet, that it has a huge surface area, and that's how the rest of the body is sending nutrients back and forth to the brain. And if you took that network of capillaries end to end, it would stretch from Los Angeles to San Francisco. Okay. So we want to keep this capillary network and our arteries and veins healthy. So this is a picture of the artery branching into these capillaries and then carrying blood back to the heart. The artery is carrying oxygen, so the blood is pink, and then once the oxygen is shared with the organ that needs the oxygen and the glucose, then the blood darkens, and it's why it's blue here, and that's so if we took a needle and drew blood from our vein, it looks dark purple, and if we puncture an artery, it would be bright red, and the difference is the oxygen content in the blood. So high cholesterol, high glucose, hypertension, high blood pressure, wear and tear on the blood vessel system. And you can get a healthy vessel starting to develop cholesterol, inflammation, plaque, and now the vessel is narrowed, and there can be inflammation, and things can pry loose and flow up into the bloodstream, and you can get a blocked artery. Diabetes, high sugar will age proteins, and the capillary may close down. So if a large artery gets clot, blood clot, then this whole area of the brain may be deprived of oxygen and glucose, and the nerve cells can no longer work, and you have an immediate paralysis or blindness or speech problem. This is a stroke. If there's a problem, this is fast. If you have sudden droop of the face, sudden weakness of the arm and leg, sudden speech disturbance, can't pronounce right or can't remember words, then time is of the essence. One can go to the emergency room and get a CT scan to see if this is if the vessel is blocked or if the vessel is broken. If the vessel is blocked, then we can give, within 3 hours, we can give tissue plasminogen activator, TPA, tissue plasminogen activator. Let's just call it Drano. You can give Drano, and it will bust the clot. Okay, but one has to have the CT scan, because if the blood vessel broke, you can make it worse by giving a clot buster. Right? So call 911. There is a primary stroke center here at Huntington Hospital, and there's also one at Verdugo Hills, and there's one at Arcadia Methodist in our area. So act fast, call 911, because the ambulance, the paramedics, call ahead and say, get the CT scanner, get the tech in, get the CT scanner on, contact the pharmacy, be sure we have the TPA ready. So we want to give it within 3 hours. There's other methods now to where you can go into the artery itself and extend a cork screw and actually snag the blood clot and pull it out. It's called thrombectomy. Yes.
What's it called?
Thrombectomy. Yes. So here's an MRI scan. We cannot see plaques and tangles on an MRI scan. We can only see atrophy, but we can see large strokes. We can see small strokes. We can see white matter changes. We can see iron deposits from broken blood vessels, iron from hemoglobin, from bleeding. We can see iron is creating a magnetic field here. This little black thing is a magnetic field from an old hemorrhage. We can see all that on an MRI. We cannot see capillary size infarcts on an MRI. Capillary is like 10 microns. Maybe a tangle is maybe 20 microns. We can't see those things yet, those real small, ultrafine things. We can see capillaries in the retina, in the eye. Here you can see small arteries, and they're paired with veins. Just if you look back through the eye with the ophthalmoscope, we can see the arteries and veins. In diabetes, which can affect the capillary health, we can see little hemorrhages, the red dot here. We can see little infarcts. We couldn't see these on an MRI, but we can see these in the eye. And with optical coherence tomography, we can see capillaries in the eye. And with diabetes, you can see that the capillary network, which fills the whole room for each one of us, is losing capillaries. They're closing down. And so diabetes is a risk factor for dementia too. Diabetes is a risk factor for stroke, for peripheral neuropathy. So this is related to high glucose. So how many of you know your risk for stroke or your risk for heart attack? You can calculate this online. Here's zunis.org. Okay, so here's risk factors for heart attack or a brain attack, which is another name for stroke. Okay, age, and here we have male and female, but put in your age, 62, total cholesterol, 185, HDL cholesterol, 74, blood pressure, 120, that's good. Atrial fibrillation, no. On blood pressure meds, yes. Oh, this is me. This is me. Yeah, I recognize myself. Except that I'm older now. How old am I?
3 years older.
Yes. Time for a new slide. Okay, so my risk for a female here, my 10-year risk for a heart attack is 8.1%. And if I were a male, it would be 11.2% with these numbers. So what I'm suggesting is you could get your risk, and then you can definitely change your cholesterol, your blood pressure,